I'm truly honored to be here. Congratulations to every one of the graduates, to your family, and to your friends. I feel a certain kinship with you. Like some of you, I was actually born in Virginia. Not many people know that. Like many of you, I grew up actually outside the country for the first 15 years of my life. And like all the graduates here, I recently graduated from being the Deputy National Coordinator to being the National Coordinator. And what I have to say to you is welcome to the revolution, because there is a revolution happening in healthcare, and Nova is one of the 82 community colleges that is on the cutting edge of this revolution. This is truly a pioneering class. You 29 Nova graduates today are part of roughly 3,000 students who are going to be graduating from our community college programs by the end of the summer. And these graduates and the 123 other members, students now enrolled in Nova's Health IT program, are part of the 6,000 students across the country who are currently enrolled. And that's just the beginning. You're part of a river that's going to become a great tide. Ultimately, these 82 colleges from the Health IT program will be graduating more than 10,000 Health IT professionals every year. And they're only going to be part of the need for Health IT professionals that are estimated this country is going to need to keep up with the pace of transformation in healthcare. So, who are these graduates? Highly trained, highly competent before you started the program, and you are now even more so. Graduates like, in Michigan, Susan Zielke. She had an MBA and 17 years of experience serving the auto industry when she was laid off. She joined the community college program. She went through the Health IT course at Mekong Community College. And she now is going to be helping doctors and nurses in Michigan's outpatient settings adopt electronic health records. In New Jersey, Karen DiNardo, she had an undergraduate degree in computer science and math. She was certified as a project manager. And she found herself unemployed and looking for new opportunities. With her experience from Raritan Valley Community College, she's working to help community health centers implement workflows that help them get the most out of those electronic health records. In Minnesota, Michael Taino, 53, at Normandale Community College, a former nurse and with software experience, took part in the community college through their distance learning, and he will be joining the workforce. You're going to be interface engineers, system analysts, information analysts, business analysts, trainers, project managers, implementation specialists. You're going to be small practice consultants. You're going to be hospital implementation specialists. You're going to work for health plans and vendors, software vendors, hardware vendors. There are going to be many opportunities for you graduates in many of those different areas. So welcome and congratulations to every person in these programs throughout the country. I gotta say, it's a good reflection on you that you had the imagination to see this new field and the drive to get in front of it in this first class. Tell your friends, or at least the ones who have the same energy, the same vision, to join this crusade that's going to change healthcare in America. So why now? Why is this health IT revolution happening now? Informatics in healthcare has been around for decades. In fact, HHS gave its first healthcare informatics grant in 1968. But while many of the other parts of our industry, of our economy, implemented IT and gained the productivity gains the quality gains, the efficiency gains that came with IT, healthcare lagged behind. Yes, healthcare is complex, but what was missing was the alignment between the business cases, between what the technology offered and what the providers needed. The alignment, mostly, of the economic incentives for the people who made the investments weren't the ones who were reaping the benefits of the technology. And for years, these factors just kept missing each other. So then what happened? Well, the nation came together in support of health IT in a truly bipartisan manner. This is one area where there is bipartisan support, if you can believe it. Second, what happened was HITECH, the Health Information Technology Economic and Clinical Health Act of 2009. And with this act, the President and Congress gave us, ONC, dramatic new resources to build that support network, especially to help primary care practices and smaller hospitals. But there were also incentive payments to help those providers realize the benefits without having to go out of pocket for the full cost. Those are significant. Those meaningful use incentive payments changed the picture dramatically. We saw, after 20 years, the rate of basic adoption of health records in primary care practices was 20%. 20% after 20 years. And within 1 year, it jumped to 30%. A 10 percentage point gain in 1 year. And that's a trend that's continuing. We're heading towards that tipping point. But Congress saw that health IT was not only transformational for healthcare, it was also a significant new area for jobs and economic growth. And we invested in this new community college program to rapidly build up this new cadre of health IT professionals. Nova and the other partner colleges were savvy enough to get in on the ground floor. The rest is history, and you're making history. The community college program is just part of an even broader workforce development effort that's supported by ONC. We're supporting a university-based training program. There's going to be 1,500 graduates who will receive certificates of advanced study in health IT. We're supporting the development of the curriculum. You all were the first to take advantage of that curriculum. That curriculum could be adopted by institutions of higher education that currently don't have a health IT program. It could be adapted by those who have existing programs. And we're also supporting a competency exam right here at Nova for health IT proficiency for those healthcare professionals. And you will be part of the first to test that and give Brian your feedback. It's not often where the test takers get to give the test maker some feedback. The time is now. This is the time. This is the time. This is the time for action. This is the time for implementation. We've designed the programs. We've designed the policies. We've designed the curriculum. You've made your way through. Now is the time for implementation. Now is when the hard work starts. Hard, but incredibly rewarding work. This is the time when execution happens. This is the time when we implement. In doing this, no one's really done this before. At this scale, through these methods. We're going to have to learn from each other. So your job as students and as educators isn't over. You're going to have to be constantly, attentively, proactively learning what works and sharing that. Finding what works. Finding those nuggets of brilliance and excellence, and being part of that never-ending drive towards continual improvement. We can never rest on our laurels. We have to constantly be moving forward. We have to constantly be thinking, systematically studying, how can we be better? We're never going to get there. We're never going to get to the end goal, but we always have to work at getting better. Systematically studying what works, sharing what works, and getting better at what we do. That's what's going to give us all the inner gratification as well as the adulation of our peers. The time is now for outcomes, for results. The time is now for health IT to clearly not be about technology, but about healthcare transformation that works together with all the other changes that are happening out there. There's a sea change coming in how healthcare is going to be paid for. It's not just going to be the volume of services that's going to end up determining how much providers and hospitals get paid. It's going to be the quality, the coordination, the safety, the seamlessness, the patient-centeredness. So what are the tools that providers are going to need to succeed in that new environment? They're information tools. They're practice redesign. It's healthcare transformation, and health IT is an absolutely essential part of that. It's a virtuous cycle where the information technology enables us to measure and improve the quality, safety, efficiency, coordination of care, and payment systems that reward those practices that do so. Let's think about it. Safety. You learned about drug alerts. Yes? Good. It's about that provider who's writing a medication that could cause a potentially fatal interaction. And without the information systems at their fingertips, there's a very real danger that that patient will join the 80,000 patients who's harmed every year, some of them fatally, by medication errors. It's about the patient who is not, their risks are not well controlled. It's the patient with high blood pressure walking around who is never called back to the doctor's office, who has a stroke, whose family is grieving. And it's the ability to call those patients back, to make a list, registry functions, right? You guys did that too, right? That's what those registry lists are about. They're about saving that person's life. You learned about decision support to help remind the providers, nurses, doctors, at the point of care when there's something that more they could be doing, giving that flu shot, even though the person came in for something else. It's about care that's less expensive, not only in preventing all of these avoidable hospitalizations, avoidable heart attacks, avoidable strokes, but it's also about making sure that when that patient is discharged from the hospital, they don't end up back in the hospital 5 days later when their medication interacted with what they already had at home, when they didn't follow up with their doctor, their primary care provider. It's about making sure that those information flows happen to prevent that readmission, one of millions of unnecessary and avoidable readmissions, each one with its own story of a family suffering. And the time is now for us to put the patient in the center of everything we do. Many of you are going to be working with providers, with doctors. I'm a doctor. I know what doctors are like. Good luck. But seriously, you're going to be working with incredibly dedicated people who every day want to do the right thing for their patients, who are working in systems that don't serve them well, who are working against systems that aren't supporting them in delivering the kind of care they want to deliver. And you will be part of making systems that support them in delivering the kind of care they want to deliver and the kind of care that the patients deserve. But don't forget, while you're doing your best to help the doctors and nurses and other healthcare professionals, and be gentle. Change is going to be difficult and scary. Be gentle. But while you do that, don't forget, it's not about the doctors and the nurses and the staff. It's about, really, the patient. And let's think about, in all the work you do, the experience of the patient. How will this feel? What are the workflows of the patient as they make their way through the healthcare system? Patients who are in pain, patients who are suffering, patients who are fearful, oftentimes. Put the patient in the center of everything you do, and you'll be all right. And put the patient's interests in the center. And I want to highlight one patient interest in particular, which is privacy and security. If we don't protect the privacy and security of the patient information that's been entrusted to us, that's housed in these health information systems, then we lose not only the public's trust, but we lose the possibility of using these tools to help improve health and healthcare. We have a special responsibility here. And what we have to be on guard against, the enemy here, is not hackers. It's not thieves and malevolence. You know what we have to be on guard against? Convenience. When it's more convenient, it's a little bit easier to do things the way we know might be taking a little bit of a shortcut. When it's using someone else's password or sharing your password. When it's not putting the backup where it's supposed to go. It's those little things that put the patient's privacy at risk and what we cannot never give in to. Do the hard thing that's the right thing. It's generally good advice. Do the hard thing that's the right thing. That's what we'll try to do. We'll try to hold ourselves to, is doing the hard things that are the right things. It's incredibly gratifying work serving this country, this great country. I'm proud of the work we do. I'm proud of my colleagues, and I'm proud of you. Thank you.